Hello, welcome to Knowledge on the Go, the podcast brought to you by the Vizient Performance Improvement Collaborative and Knowledge Transfer teams. I'm Nicole Spatafora, Senior Director of PI Collaboratives and your program host.
When COVID hit, it seemed like immediate fear and confusion. We had all seen what had happened in Europe. We had seen the devastation that COVID brought to New York City, and we got hit not long after that. And so there was an immediate concern that we were going to turn into New York as well.
Kevin Smith is Chief Medical Officer at Loyola University Medical Center, a 547-bed academic medical center in the western suburbs of Chicago. It has 2 community hospitals, and he works at the main center. Kevin not only had to deal with a relatively unknown disease and stressed out staff, but he also was new in his professional role.
So when the COVID crisis started, I was a new CMO. So I started as a chief medical officer in January. COVID hit us in March, and this was actually my first time being a CMO. So it was quite a trial by fire, and I can say now a learning experience, but at the time, full of really stressful moments.
And Kevin wasn't the only new leader at Loyola.
We were actually, as a whole, a new leadership team. So we had a new CEO that had been in place for maybe about 18 months. We had a new president that was in place for maybe a year at most, a new CNO who started right before me, myself. We also had some new regional leadership. And so that, I think, was the opportunity for us really to come together as a leadership team.
Loyola's new leadership had to set aside their own fears. They met daily to support the staff and plan next steps for safety and COVID patient care. It was a show of unity and strength.
We thought it was very important as a leadership team for us not to be working remote, but to actually be on campus. And we spent a lot of time together, including in person, trying to work through these problems. And when you spend a lot of time together, you start to develop this level of trust. And that trust was really what created that support. And this level of trust continues on to this day. And so I think we're actually closer as a leadership team because of this crisis that we went through during COVID.
The new leadership had a lot to overcome. Data was flooding in, and it was changing just as quickly. Leaders communicated with the staff as best as they could. Still, there were conflicting messages. Staff didn't know what to believe, creating confusion and stress.
They heard one message coming from our leadership, and then may have heard a different message coming from the CDC. I think the biggest challenge was really reassuring people that we were trying to be as transparent as possible. Naturally, anytime there's incomplete information, people start making up a narrative in their mind. And that narrative oftentimes may point the fingers at administration saying, why aren't you doing more? But we really tried to reassure people. We really were trying to do everything we could. And it was just the information was changing so quickly. At one point during the COVID pandemic, I decided that I was actually going to stop my CMO update that I sent out to the medical staff because I thought there were too many mixed messages. The feedback I got was actually that was not the right decision. Our physicians wanted to hear from me as a local leader, but it was just that I needed to be much more consistent in messages that were coming from myself versus from our regional communication.
The message needed to be unified, and it had to come from the top. Leadership scheduled weekly town hall meetings to share the latest information and hear their employees' concerns.
We decided that we were going to start actually doing regular town halls virtually and invite whoever out of the employees would like to come on that virtual town hall. We also elicited questions from our employees as well. And I think that was a great opportunity for everybody to hear the set message and really to have their fears heard and addressed. Communication is key.
They didn't stop at town halls. They also did brief, in-person daily huddles with medical directors, nurse managers, and other leaders to share COVID information and field questions.
People weren't asking a lot of questions, but the attendance was really great. And I think it mainly was just an opportunity to make sure they heard what was going on and they didn't feel left out and cut out the loop.
That unified the staff, not only at the local level, but as a system.
COVID was really the first time that we acted truly as a 3-hospital system. Before COVID, we often operated as 3 separate hospitals that would involve each other when needed. But in this particular circumstance, we had to be coordinated. And so we had 3 times weekly phone calls between our different hospital leadership at the ICU level to make sure we were coordinating bed placements. Patients can go to this hospital versus they go to this hospital. It depends on the staffing and the space. And that really was instrumental with helping us get through from an operational standpoint, but also forming those tighter relationships that we're going to need as we strengthen this regional bond.
Kevin says he got through the COVID crisis by taking it one day at a time. But when he steps back, he realizes that there were a lot of positive things that resulted from his trial by fire.
When I first started as a CMO and came into COVID, it was probably some of the hardest days of my life. But I got through it. And it made me realize that I do have the skills to succeed in this role. I realized that I don't necessarily have to be the smartest person in the room. There were people who knew more about COVID, who had a much better understanding of the medical aspects of things, but that's okay. As long as I had the right people in the room, I was asking the right questions, I developed the right team, I could be successful. I learned that everybody is in a different spot during a crisis. And if I was going to be successful, if I was really going to reach people, I was going to have to understand where they stood during this crisis and realize that they weren't probably in the same place as myself. And so that allowed me to tailor my discussions with people. It allowed me to understand when I had to support people, when I could push people, when I was in a situation I actually needed to ask questions because I needed to learn more to figure out how I could help them. And that's a skill that I'm going to carry with me from now on as well. I think this also taught me that one of the characteristics that I think sets me apart from some other people is just grit. There's a great book about grit, and it talks about that's really one of the big characteristics of success for leaders. And I think that's very true. And I think that's a characteristic that I possess. COVID also allowed me to understand that if I develop a good team around me, it takes the weight off of myself and I'm much more effective. So that if I delegate, if I support, then we all rise together as a team and it makes our institution so much more successful.
Thanks to Kevin Smith from Loyola University Medical Center for sharing his personal story, and to you for listening to our podcast. We'd love to hear from you. Send an email to knowledgetransfer@vizientinc.com. From the PI Collaborative and Knowledge Transfer teams, I'm Nicole Spatafora. Remember, knowledge is transformational. Share it.